Have you felt your legs growing weaker? Each step becoming slower, shakier. Even standing up from a chair feels like a challenge? Did you know that every day you sit too long, your legs are slowly dying without you even realizing it? We're often told, old age means getting weaker, slowing down. But the truth is, many people aren't weak because they're old. They're weak because of a sedentary lifestyle and outdated medical advice. A 2023 study from the International Journal of Geriatric Medicine found that 70% of Americans over 70 suffer from muscle loss, not because of disease, but because they sit too much. They're not encouraged to move, not taught how to rebuild strength, and worse, many are prescribed medication instead of simple exercises. Every year, over 25% of people over 65 experience a fall, partly due to weak legs, and partly because no one talks about this reality. This isn't your fault, it's a failure in how we care for our elderly. No one warns you that just 2 weeks of bed rest or prolonged sitting can cost you up to 7% of your leg muscle mass, a staggering number. Even worse, the medical industry rarely mentions it. They talk about pills, interventions, treatments, but often they prescribe rest or medication, when the real issue could be muscle loss, vitamin B12 deficiency, or even nerve damage from uncontrolled diabetes. The scariest part? When weak legs become the beginning of a tragic chain: fall, fracture, bedridden, loss of independence. No one tells you how to keep your legs strong and stable, through simple actions you can do at home. Have you ever felt your legs getting weaker and didn't know why? Has your doctor ever warned you about muscle loss from inactivity, or deficiencies in vitamin B12, D, or calcium? Leave a comment below, we want to hear your story. And if you want to keep learning the untold truths, hit subscribe and turn on the notification bell. Because sometimes, one piece of timely information can keep you standing strong for life. Number 1. Muscle loss from inactivity. As we age, the body naturally loses some muscle mass, a condition known as sarcopenia. But inactivity, like prolonged sitting or lack of exercise, accelerates this process, leading to muscle wasting. According to a 2023 study in the International Journal of Geriatric Medicine, about 70% of older adults in the U.S. over age 70 show signs of muscle loss due to a sedentary lifestyle. This weakens the leg muscles, especially the thighs and calves, making movement increasingly difficult. Imagine muscles like an engine. If you don't use it, it rusts and loses power. As muscles weaken, not only does walking become harder, but the risk of falling skyrockets. A serious concern when the CDC reports that each year, over 25% of adults over 65 fall, and 1 in 5 of those falls causes serious injury like fractures or head trauma. Worse still, muscle loss reduces your ability to recover from injuries, leaving you more dependent on others. Why does inactivity cause muscle loss? Scientifically, when you stop using your muscles, your body reduces production of the proteins needed to maintain and repair muscle tissue. The muscle fibers, especially type 2 fibers, which are responsible for strength and speed, begin to shrink and disappear. A study from the U.S. National Institute of Medicine showed that just 2 weeks of inactivity can cause older adults to lose 5 to 7% of their leg muscle mass. This is especially serious if you're hospitalized or immobile due to illness. Moreover, being sedentary reduces blood flow to the muscles, depriving them of oxygen and nutrients. The result? Weaker muscles, and you feel tired after just a few steps. On top of that, muscle loss affects balance, increasing the risk of falls, a dangerous spiral. How to reverse muscle loss and regain strength? Don't worry, the good news is, you can prevent and even reverse muscle loss with simple science-backed changes. Here are 3 practical solutions. 1. Strength training exercises. Light squats, leg lifts, or even just standing up and sitting down from a chair can stimulate muscle growth. A 2022 study from the Journal of Physical Therapy found that seniors who did strength training 2 to 3 times a week for 12 weeks gained 10 to 15% more leg muscle mass and significantly improved walking ability. You don't need a gym, just a chair and 10 minutes a day. Start with simple movements. Stand up and sit down 10 times, rest for 1 minute, then repeat 3 times. 2. Increase daily activity. Walking is the best medicine for your legs. According to the American Heart Association, walking 30 minutes a day, 5 days a week improves circulation and maintains muscle mass. If you're not used to it, start with 10 minutes, broken into 2 to 3 short walks a day. Walk around the house, the park, or even the grocery store. Every step counts. 3. Nutrition to support muscles. Muscles need protein to rebuild. Experts from the Academy of Nutrition and Dietetics recommend that older adults consume 1.2 to 2.0 grams of protein per kilogram of body weight per day. For example, if you weigh 70 kilograms, about 154 pounds, aim for 84 to 140 grams of protein from sources like eggs, fish, chicken, beans, or yogurt. Additionally, getting vitamin D from sunlight or supplements also helps strengthen muscles, according to a 2021 study in the Journal of Clinical Endocrinology. Don't let muscle loss steal your mobility. Start today with a simple exercise or a protein-rich meal. We want to hear your story. What have you done to keep your legs strong? Or what challenges are you facing? Leave a comment below and share with our community. Number 2. Chronic venous insufficiency, CVI, in the lower limbs. What is chronic venous insufficiency, and why is it dangerous? Chronic venous insufficiency in the lower limbs occurs when the veins in the legs can no longer pump blood effectively back to the heart. The valves in the veins, which act like gates to prevent blood from flowing backward, become weakened over time, causing blood to pool in the legs. This leads to swelling, pain, and a heavy sensation, reducing leg strength. According to a study published in the Journal of Vascular Surgery USA in 2024, approximately 40% of Americans over 65 show signs of venous insufficiency, and this figure rises to 60% in those over 75. Venous insufficiency is not only uncomfortable, it carries serious risks. Blood pooling reduces the oxygen and nutrients reaching the muscles, leading to muscle weakness and difficulty walking or standing for long periods. More seriously, this condition can cause complications like leg ulcers or deep vein thrombosis, DVT, a dangerous situation where blood clots form in the veins. According to the U.S. Centers for Disease Control and Prevention, CDC, around 10% of elderly people with severe venous insufficiency are at risk of developing leg ulcers, decreasing their quality of life and increasing the risk of infection. Why are older adults more prone to venous insufficiency? Scientifically, vein valves weaken with age, especially when combined with factors like inactivity, obesity, or a history of standing for long hours. When blood isn't pumped efficiently, pressure increases inside the veins, stretching and damaging the vein walls, making them unable to function properly. A study by the U.S. National Heart, Lung, and Blood Institute revealed that older adults with sedentary lifestyles are 3 times more likely to develop venous insufficiency compared to those who stay physically active. Other contributing factors include genetics, hormonal changes in women, or underlying conditions like diabetes. Imagine your legs as a plumbing system. If the valves break, water, blood pools and increases pressure, damaging the entire system. The result? Pain, fatigue, and legs that lose the strength to perform daily tasks like walking or climbing stairs. How to improve vein health? You can manage and improve venous insufficiency with simple, science-backed changes. Here are 4 helpful solutions. 1. Increase movement and light exercise. Exercises like walking, stationary cycling, or leg lifts help stimulate blood circulation and reduce pressure in the veins. A 2023 study from the Journal of Sports Medicine showed that elderly individuals who walk 20 to 30 minutes a day, 5 days a week, reduce swelling and pain symptoms by 30% after 8 weeks. You can start by walking around your home or the park. Or try a leg elevation exercise. Lie on your back, raise your legs up a wall for 5 to 10 minutes daily to assist blood flow back to the heart. 2. Wear compression stockings. Compression stockings apply gentle pressure to the legs, helping veins pump blood more efficiently. According to the American Society for Vascular Surgery, regularly using compression stockings can reduce swelling and pain symptoms by 50% in people with mild to moderate venous insufficiency. Choose stockings with 15 to 20 millimeters of mercury compression pressure, and wear them in the morning before leg swelling begins. 3. Maintain a healthy weight and balanced diet. Excess weight increases pressure on the veins, so losing weight, if needed, can improve symptoms. A diet rich in fiber, vitamin C, and E from leafy greens and fruits like oranges, grapefruits, and berries help strengthen blood vessel walls. A 2022 study from the Journal of Clinical Nutrition found that flavonoid supplements, from foods like grapes or blueberries, improved vein elasticity in 65% of participants after 12 weeks. 4. Avoid prolonged sitting or standing. If you sit for long periods, try to get up and walk every 30 minutes. If you must stand for long periods, Try calf stretches or heel raises, 10 to 15 times per hour, to stimulate circulation. According to the U.S. National Institute of Medicine, these small changes can reduce the progression risk of venous insufficiency by 25%. Don't let venous insufficiency stop you from enjoying an active life. Try one of these solutions today, even just a 10-minute walk or trying out compression socks. We want to hear your story. What symptoms have you experienced in your legs, and what have you done to improve them? Number 3. Vitamin B12 deficiency. Vitamin B12, also known as cobalamin, is an essential nutrient that maintains the health of the nervous system and supports red blood cell production. When the body lacks B12, nerves in the legs can be damaged, leading to symptoms like numbness, tingling, or muscle weakness. According to a 2024 study from the American Journal of Internal Medicine, about 20% of Americans over age 65 are deficient in vitamin B12, and this increases to 30% in those over 75. In older adults, the ability to absorb B12 from food decreases due to reduced stomach acid or conditions like gastritis. Vitamin B12 deficiency doesn't just cause weak legs, it also carries significant risks. Peripheral nerve damage from B12 deficiency can impair balance and increase the risk of falls, a serious concern, since the CDC reports over 800,000 hospitalizations annually among seniors due to falls. Moreover, if left untreated, B12 deficiency can lead to more severe outcomes like irreversible nerve damage or anemia, causing full-body fatigue. Why are seniors more likely to be deficient in vitamin B12? Scientifically, B12 absorption is a complex process involving the stomach and intestines. In older adults, factors like reduced stomach acid, use of proton pump inhibitors, e.g. omeprazole, or autoimmune gastritis can interfere with this process. A study from a U.S. National Institute of Nutrition found that seniors who consume fewer B12-rich foods, like meat, fish, eggs, or follow vegetarian diets have 2 to 3 times higher risk of deficiency. Additionally, symptoms like leg numbness, muscle weakness, or balance loss are often mistaken for natural aging, causing B12 deficiency to go undiagnosed. Think of your nervous system like an electrical wiring system. If B12 is missing, the wires get damaged, interrupting the signals between the brain and muscles, making your legs weak and harder to move as you wish. How to replenish vitamin B12. Don't worry, B12 deficiency can be reversed with simple, science-backed solutions. Here are 3 effective methods. 1. Increase intake of vitamin B12-rich foods. Foods like salmon, beef, liver, eggs, and dairy are excellent natural sources of B12. According to the American Nutrition Association, seniors should consume at least 2.4 micrograms of B12 per day. For example, 185g serving of salmon provides about 4.8 micrograms of B12, enough to meet daily needs. If you're vegetarian, try fortified cereals or plant-based milks with added B12. A 2023 study in the Journal of Clinical Nutrition found that dietary B12 supplementation improved leg muscle strength in 70% of seniors after 12 weeks. 2. Use supplements or B12 injections. If your body has difficulty absorbing B12 from food, supplements or B12 injections are effective alternatives. According to the Journal of American Neurology, taking 1,000 micrograms of B12 daily, oral or injectable, improved numbness and leg weakness in 80% of B12 deficient patients within 4 to 8 weeks. Consult your doctor for a blood test to assess B12 levels and determine the appropriate dosage. 3. Combine physical activity to support nerve health. Light exercises like walking, yoga, or stretching improve circulation and support nerve recovery. A 2022 study in the Journal of Physical Therapy showed that seniors who combined B12 supplements with 20 minutes of daily walking improved mobility and balance by 25% compared to those taking B12 alone. Try walking around the house or doing simple yoga poses like the tree pose to strengthen your legs. Don't let vitamin B12 deficiency silently weaken your legs. Check your diet, add some salmon to your dinner, or ask your doctor about a B12 test. We want to hear your story. Have you experienced symptoms like leg numbness or muscle weakness? What have you done to improve? Number 4. Vitamin D and calcium. Vitamin D and calcium are an essential duo for bone and muscle health. Vitamin D helps the body absorb calcium, while calcium is the main component in building and maintaining strong bones. When these two nutrients are lacking, bones become brittle, muscles weaken, and it becomes difficult to walk or maintain balance. According to a 2024 study published in the Journal of American Geriatrics, about 50% of Americans over the age of 65 are deficient in vitamin D, and 35% do not get enough calcium from their diet. This is especially common among individuals who have limited sun exposure or follow an unbalanced diet. A deficiency in vitamin D and calcium not only causes leg weakness but also increases the risk of osteoporosis and bone fractures. According to the U.S. Centers for Disease Control and Prevention (CDC), more than 30% of older adults fall each year, and those who are vitamin D deficient are twice as likely to suffer a hip fracture when they fall. Muscle weakness due to vitamin D deficiency also reduces balance, making you more prone to falls. Imagine the loss of confidence when walking simply because your legs are no longer strong enough. That's something we can absolutely prevent. Why are older adults more prone to vitamin D and calcium deficiency? Scientifically, as we age, the skin loses its ability to produce vitamin D from sunlight, and the kidneys become less efficient at converting vitamin D into its active form. At the same time, the ability to absorb calcium in the intestines decreases due to aging or medical conditions such as gastritis. A study by the U.S. National Institute of Medicine found that older adults who stay indoors and rarely go outside are 3 times more likely to be vitamin D deficient than those who are regularly exposed to sunlight. A poor diet lacking foods like dairy, fatty fish, or leafy greens also worsens the deficiency. Think of your bones and muscles as a house. Vitamin D and calcium are the bricks and cement. Without them, the house becomes unstable, making it hard to move and increasing the risk of accidents. Solutions: how to supplement vitamin D and calcium. The good news is that you can correct vitamin D and calcium deficiencies with simple, science-backed changes. Here are 3 practical solutions. 1. Increase intake of foods rich in vitamin D and calcium. Foods like salmon, sardines, milk, yogurt, cheese, and green vegetables, such as kale and broccoli, are excellent sources. According to the American Nutrition Association, older adults should consume 800 to 1,000 IU of vitamin D and 1,200 milligrams of calcium per day. For example, 1 cup of milk provides about 300 milligrams of calcium and 100 IU of vitamin D. A 2023 study published in the Journal of Clinical Nutrition found that increasing intake of calcium and vitamin D-rich foods improved leg muscle strength in 65% of older adults after 12 weeks. 2. Get safe sun exposure. Just 10 to 15 minutes of sun exposure daily, in the morning or late afternoon, can help the body produce enough vitamin D. According to the Journal of Clinical Endocrinology, sun exposure 3 to 4 times a week increased blood vitamin D levels by 20 to 30% in older adults. Try taking a light walk in the park or sitting by a sunny window, but remember to avoid harsh midday sun to protect your skin. 3. Use supplements and exercise. If diet and sunlight are not sufficient, vitamin D supplements, 800 to 2000 IU/day, and calcium supplements, 500 to 600 mg/day, are safe options. A 2022 study in the Journal of Sports Medicine showed that older adults who took vitamin D supplements combined with exercises such as walking or light weightlifting increased their leg strength by up to 25% after 8 weeks. Try simple exercises like standing up and sitting down 10 times or walking for 15 minutes daily to support your bones and muscles. Don't let vitamin D and calcium deficiency stop you from enjoying an active life. Start with a cup of milk in the morning, a walk in the sun, or consult your doctor about a vitamin D test. We'd love to hear your story. Have you experienced any leg difficulties, and what are you doing to improve your health? If you found this video helpful, don't forget to share it with your loved ones, especially those who are starting to feel leg weakness or balance issues. And if you have any questions or want me to make a video on a specific topic like nutrition, muscle recovery exercises, or fall prevention, leave a comment below. Click subscribe and turn on the notification bell, because we will continue to bring you clear, easy to understand and practical medical knowledge to help you live healthy, live actively, and live strong every day.